So good afternoon, everyone. So let's start with the next part of the repertory. Okay. So today we will do the Boning-Hussain therapeutic pocket books. So what are the questions can come from these chapters and multiple choice question or the Viva question? I will tell you accordingly when I go forward to the slides. Okay, so Boning-Hussain therapeutic pocketbook. The first question they can ask you, what is the full name of the Boning-Hussain therapeutic pocketbook? They can ask you this name either in the Viva, okay, or they can ask you in the multiple choice question. They will give you the four options. Okay, so what is the full name? You should mug it up. It's a very important Viva question. That is the principle and the practicability of the Boning-Hussain therapeutic pocketbook for the homeopathic physician to use at the bedside in the study of the materia medica. Okay, so this is basically the full name of the book. It is in Boning-Hussain therapeutic pocketbook for homeopathic physician to use at the bedside in the study of the materia medica. Okay. Now let's move to the in this case the Btpb, the introduction part. Now if they ask you the question, the introduction part was given by whom? The introduction part was given by Dr. H.A. Rasputs and the N.E.C. Wilson. Okay. So this is another important question. The introduction of the Boning-Hussain therapeutic pocket book was given by H.A. Robert and the N.E.C. Wilson. Okay, you should buy this book. This is basically the book, Boning-Hussain therapeutic pocket book, and its introduction by given by the H.A. Robert and N.E.C. Wilson. These are the two questions they can ask you in the Viva or in the multiple choice question. Baron Clemens Maria Franz von Boning-Hussain. Now, this is the full name of the Boning-Hussain. They can ask you what is the full name of the Boning-Hussain. The answer will be Baron Clemens Maria Franz von Boning-Hussain. Okay, he was born in the year of 1785 in Netherlands on his father's estate. So, where the place of birth is Netherlands. Okay, so this is one of the MCQ. His family has a Westphalian and Austrian ancestry with the history of the military service. He studied civil and criminal law in which university? Georgian University. Okay, so this is one of the MCQ question. He studied the law. Okay, he never studied the medicines. Okay, he studied the civil and the criminal law, and he served at the court of the Louis Napoleon, who was a king of the Holland, an important judicial and the administrative role. Okay, so basically this is a life and experience of the Boning-Hussain. After 1810, he retired from the Dutch civil service, married and settled in the Western Prussia. Okay, so remember these are basically what are the MCQ questions? They only come from this side. His place of birth. Okay, he was graduate in which subject, that is a doctor of the civil and the criminal law, which university. Okay, and he served in which court? Louis Napoleon, the king of the Holland. Okay, Holland, and he retired at the after 1810. Okay, and he was very much interested in the agriculture and the botany. So he forms the first agriculture society in the West. Okay, so Germany first agriculture society was formed by the Dr. Boning-Hussain. In 1816, he was appointed president of the Provisional Court of the Justice for the Westphalia. Okay, so this is a very important MCQ. That is, the first agriculture society in the West was formed by whom? By Dr. Boning-Hussain. Okay, so Boning-Hussain studied the local flora, and he was deeply, though he has studied the civil and the criminal law, but he studied more towards the botany. Okay, and he get recognized because of his work. Okay, and he was honored by name plant species after him. Now he suffered in the year of 1827. He suffered from the tuberculosis. Okay, so this is one of the important MCQ. And his friend, what is his friend? The doctor, he gave him pulsatilla. Okay, so by prescribing pulsatilla along with some hygienic condition, he recovered gradually and completely from this ailment. So this is another important question: which medicine was prescribed? Who prescribed this medicines? And this is basically the turning point for the Bonninghausen, and he turns into the homeopathy. Okay, now this personal cure gave him a strong belief in homeopathy, and he began to study and promoting it actively despite his not being a qualified physician. Now, you know that he wrote his first repertory, that is repertory of antisoric, in the year of 1832, and Jhar credited him with the evolution system of this remedies. So this we will give you to the later part. Okay, that is the who give him the credit for the evolution of the remedies, Jhar. Okay, so this is one of the important MCQ question. And in 1843, King Frederick IV William permitted him to practice medicine freely despite not having medical degree. So you can understand, basically from here we can know the how the life of the Bonninghausen. Okay, and these are the some of the multiple choice questions, and what type of the viva question can come from this part also. Now, there are some major works done by the Bonninghausen in the chronological order. You should remember this. The first is the cure of the cholera and its preventive, repertory of the antisoric, summary, a view of the chief sphere of operation of the antisoric, and attempt at homeopathic therapy of the intermittent fever, contribution to a knowledge of the peculiarities of the homeopathic remedies on 1833 homeopathic diet, and complete image of the disease for a lay public. You see, so these are the important work done by the Bonninghausen. You should remember this for your multiple choice examinations. Okay, so they can ask you in match the following. They can give you few books, and then they will ask you the author of the books. Okay, so you should remember this one. This is also 1834 homeopathic manual for the non-medical public. 1835 repertory of the medicines which are not antisoric. Attempt at showing of the relation kinship of the homeopathic medicines, and the therapeutic manual of the homeopathic physicians, which we know as your Btpb Bonninghausen therapeutic pocket book. Remember, the Btpb is basically the combination of the repertory of the antisoric medicines, which is not antisoric, and attempt and showing the relation kinship of the homeopathic materia medica. Okay, so these are basically the three together, combined together, and form the Bonninghausen therapeutic pocket book. In 1849, brief instruction for the non-physician on the prevention and the cure of cholera. 1853, the two sides of the human body and their relationship. 1853, the homeopathic domestic physicians in brief therapeutic diagnosis. And in the year of 1860, the homeopathic treatment of whooping cough. In 1863, the aphorism of Hippocrates with notes by a homeopath. So these are very important, some of the major work of Bonninghausen, and this is all about. In the next class, we will do the the next part of the Bonninghausen therapeutic pocket book. Okay, so this is basically from this introductions of the therapeutic pocket book. So they can ask you who is he, who wrote the introduction. Okay, and this book was written in the German language. Okay, remember this, Btpb was first written in the German language, and the introduction was given by H.A. Robert and N.E.C. Wilson. Okay, in the next part we will do the philosophical background.